welcome everyone. So today is our webinar, A Diagnosis for Us All, Understanding Rare Dementia Support. And thank you for tuning in. My name is Herman Chique-Alfonzo, and I'm the Education and Program Coordinator for the Dementia Society of Ottawa and Renfrew County. We are delighted to present our speaker today. She is Dr. Mary Pat Sullivan. She's a professor of social work and social gerontology at the Nipissing University, and she's also a co-investigator on the 5-year rare dementia support study funded by the National Institute for Health Research and the Economics and Social Research Council in the UK. In addition, we're happy to have Dr. Adetola Grillo. So she is a Postdoctoral Research Fellow in Nipissing University, working also with Dr. Sullivan on the Rare Dementia Support Impact Study. So without further ado, I'll turn over to the speaker. Mary, it's all yours.
Well, thanks very much, and thanks to everyone for joining us today. Adetola and I are delighted to join you and share with you some of the work we're doing here in North Bay and across the country, and with colleagues in the United Kingdom to understand more about rare dementia. And the title of our presentation is A Diagnosis for Us All, and that comes from one of our research participants. So from an individual who told us when they were diagnosed with a particular form of dementia that the diagnosis really was for the entire family, not just for the individual. And I'll return to that message as we go on. So first of all, just to explain in some of the terminology we use and why rare dementia is important and why we're looking at it. So up to 15%, and some studies suggest even higher, that people are living with a dementia diagnosis that is a rare form, and I'll share a bit more about that in a minute, or an inherited form of dementia, or young onset dementia. So dementia that normally the onset is prior to the age of 65. And that's primarily the common term that we use for people who are diagnosed before the age of 65. But what we're not doing here is identifying the type of dementia. Now, because of the younger age, symptoms are often misunderstood within the professional community as well as within individuals. And so people tell us that it takes a long time, sometimes up to 5 years, for people to get a diagnosis, a correct diagnosis. And then the literature tells us that up to 30% of these individuals will instead receive a diagnosis of a psychiatric problem rather than they're experiencing a form of dementia. Now, within this smaller group of people, 1%, roughly 1%, will have an inherited form of dementia. And we're hearing more about that now in relation to genetic counseling and testing. And that's typically an inherited form of Alzheimer's disease or an inherited form of frontotemporal dementia. So when I use the word, or Adetola and I use the word rare dementias, these are atypical forms of dementia. So these aren't typically Alzheimer's disease, but other types of conditions causing dementia. And these other forms typically affect people in younger age. And so on your screen here, I'm listing the atypical or rarer forms of dementia that are typically affecting young people. Now, I don't want to describe and go through them all, other than to highlight the variety of conditions that are causing dementia and the importance now of identifying these types of dementia so people can get the right information and support to understand their symptoms and the impact of these conditions, given they often affect people in a different way than typical Alzheimer's disease does, as well as because individuals are often in a younger age group. Now, I'm just going to stop for a minute, and Adetola is going to share with us a short video to give an example of what atypical dementia can look like.
I suddenly didn't know where to position my eyes in relation to the road.
It was raining and the light was going straight into your face and you just don't see it properly.
I zigzagged all the way, leaving tire marks.
Going over the pavement, hitting bollards or whatever.
I just thought, what's going on?
What if there'd been someone standing there instead of that bollard? I didn't know there was anything wrong. I didn't know there was anything wrong.
Dementia? Why would you think it's dementia? It's so fiendishly complicated. There's how many million neurons involved in visual processing. Once certain neurons stop functioning as well as they would have done, virtually any combination of bits of your visual processing might go.
So the eyes are seeing it, but the brain is not recording it in a little slot back here.
It's an image that your brain's made up from what your eyes have captured. And so if it makes it up wrong, it's then persistent, which is not always true of people with normal Alzheimer's.
An ordinary eye test won't necessarily show much. So if you're looking at A, B, D, E, F, that's not a problem. But if you're trying to read a line...
I get the first word, and when I go on to the second word, the first word's gone.
Some from this sentence, and some from this sentence, and then coming back up to this sentence.
Blobs on a piece of paper. Everything does dance around, all the letters, and eventually just becomes one big blur. I've read extensively all my life, and I can barely read. I'm writing, crowded page. It's moving, it's mutating, it's everything in you.
C C C C C H U R C C C C H.
F's instead of 5s, B's instead of P's, P's instead of B's.
There's a number of funny little things in my brain. And sometimes some do things, and sometimes others do things.
It's very frustrating to go to get something and it's not there, but it's there.
I can often see things faster if they're moving.
And so if a bird flies across his vision, he's got it. He knows what that bird is, he can see it exactly as it was before, because it's dragged his eye to it.
The glare when you're walking along, it's very, very bright.
And there's shadows and reflections or glistening puddles. Is it real? Is it solid ground? Is it something you're going to go down?
Going downstairs, I can't see my feet. I always feel for the first step so I can gauge the rhythm of the stairs.
You do not know where to put your feet, so you get vertigo. It gives you vertigo.
Well, it's like standing on the edge of something that you could just jump.
I can play all the notes. but not necessarily in the right order.
I can make a cup of tea, but if Graham talks to me in the middle of that, I will forget at what stage I was at.
Well, yeah, first of all, I've got to find a cup.
It's almost as though he must be able to see it.
I can see it, but I can't see where it is.
I still couldn't see it. It's like, where? There. Where? There! There's a real one and there's an image. I can't distinguish between them.
You have to sort of dismiss the whole image somehow and then get it to reassemble the whole thing, and then the kettle might be there again.
Like your reading glasses are in the midst of a load of other things. You can't spot them very easily.
The whole thing, you do see it rather like a bridal painting, and a sort of crowded, surreal.
My fingers were like bananas.
I can't use the phone
You
properly.
can remember the code for your cash point, but you couldn't work the machine to put them in the right order.
Oh yeah, I can see the computer, and something will come up on the screen. If I press the wrong key, then I'm stuck.
And I can't find my way around the keyboard. I mean, that fumbling for the letters.
He's just pressing more buttons and getting deeper and deeper and deeper into a mess, and he doesn't know it.
I have not, in 5 or 6 years now, had a clear explanation, and I don't think we're giving you one now. What is it that you actually see?
I can see, but I can't see.
It's very hard to describe what somebody sees to somebody else. We might all see this differently, but we would assume we all see it the same. But I can't say, what do you see? Because you're going to look at me and say, well, I see what you see, aren't you? You're going to say, well, I see that. It's such an amazing thing.
Thank you, Adetola, and I'll go back to my screen. So I hope everyone can see my screen again. So I hope that that gives you a sense of some of the unique features of people who've been diagnosed with posterior cortical atrophy. And so what's striking in that film is how the eyes are not, or the brain is not capturing what the eyes are seeing, but everyone is still very articulate and aren't complaining with, are not complaining or talking about problems with their memory, which is normally what people think about when they think about dementia. And so our study, the Rare Dementia Support Impact Study, is working with colleagues at the Rare Dementia Support in London, England, where since the 1990s, they've been leading a service to support people with different types of dementia that, as I said, normally occur in a younger age. And what they focus in on is providing a specific tailored advice around individuals' type of dementia and how best to support people who are living with problems that are different than people living with Alzheimer's disease. And they've developed a community of individuals from across the United Kingdom and indeed across the world. So people are reaching out there for support and information because it's often not available in their own home countries. And we're doing a lot of work in relation to learning. So learning more about these unique conditions, as well as how to best support people. And so our whole study is focusing on looking at the service that they're providing and gathering more individuals with these different types of dementia on how to best to continue to support individuals and their families. And so here in Canada, we're participating because in Canada, we too do not have any specific supports in relation to people with these different types of dementia that are particularly tailored for this for these different types of dementia. And so we're learning more from Canadians about where they're getting currently getting support, what's working and what's not working, and what they think they may need to better live with these conditions, as well as how families can best support them. So as part of our study, Adetola and I have virtually, because of the pandemic, virtually walked back and forth across Canada to learn where there is a specific support for people with these different types of dementia, what type of support is available, and what are people experiencing when they're reaching out for support. And so what I have here are a couple of quotes from people that told us what they were experiencing. So the first one is a care partner, and he's caring for his wife who has posterior cortical atrophy, so very similar to the film. And he told us, I had no clue what was going to happen post-diagnosis. Because of PCA being so rare, we've been, I think in the last count that we had since we've moved, my wife has been associated with 14 different medical professionals. And one of these 14 medical professionals, he had heard of PCA before. And another person living with a rare form of dementia told us, you know, rare is rare. No one can tell me anything. And so you get an understanding or the sense of frustration from people where they can't get the right information in terms of understanding what's happening to them. And so when we spoke to professionals alongside speaking with people with rare forms of dementia, we were able to gather what we call an analysis of the situation. And that's just a sophisticated research term, which really means to understand where are we in terms of supporting people with rare dementia in Canada. Well, the first point was that amongst people working with dementia and others and the general population, that there was a lack of recognition of dementia diversity, meaning that everybody doesn't experience Alzheimer's disease, that there's these various other conditions that are important. And because of the lack of recognition that dementia is diverse and affecting younger people as well as older people, both diagnostic services and post-diagnostic support are lacking. It doesn't mean it's not there. It is there in some cases, but generally speaking, it's lacking, or what I say, it's patchy across the country. So you may have more support living in a large urban center, depending on which province you live in, and less support living in a smaller urban or rural community, again, depending on which province you're living in. And generally speaking, we continue, and rightfully so, because we have an aging population, but the focus still is an aging population with Alzheimer's disease and younger people with different conditions feeling left out or ignored. So these rare types of dementia are poorly understood because they are underexplored in the research and poorly understood within the health and social services sector. And so the supports that are there across the country are largely fragmented. So you might get a little bit of support if you live in northern Saskatchewan or downtown Toronto or in Ottawa, but if you live out in Moncton or St. John's, Newfoundland, there might not be anything at all. And when individuals are reaching out for information and support, we tend to provide information and support that is generic, rather than tailored to think about what is the exact condition or diagnosis that underpins the dementia that an individual is experiencing. And then just family support for the entire family. So we're working with individuals who are in their 40s. They still have children at home. They're still supporting parents. They have a partner at home. And so support for that entire family system is also hard to find. Well, what are we learning when we speak to, and we've been speaking to people across Canada with these other types of dementia and are still keen to speak to more people. So if you know of anyone that might be interested in sharing their experiences of their condition with us, we would appreciate that. But what do people are telling us so far? So as I said earlier, that people are waiting 2 to 5 years to get a diagnosis, just simply because they're young and simply because their symptoms are not about being forgetful, but not being able to drive, for example, because they can't see the road. We do know that we have a lack of dementia specialists across Canada. So that's making the diagnosis even harder. People are struggling, particularly in small urban or rural communities, to navigate getting genetic specialists in case they have a familial type of Alzheimer's disease or frontotemporal dementia. And the high levels of stigma associated with any type of dementia are making people fearful of even going to ask for help. Like I mentioned earlier, people telling us that specific information for the different types of dementia are lacking, and the information people are getting is more generic rather than tailored. So what do I do in terms of my specific condition and to manage that and to have people support me? And when might I have a need in terms of my dementia journey? And what will I need? Information on how we communicate with our families and friends, or even our employer, if I'm only 50 years old and the doctor tells me that there's something wrong. Thinking about condition-specific support, people with primary progressive aphasia might need specific information and support around communication techniques. Someone with posterior cortical atrophy may need help in terms of thinking about adaptations to their home environment to manage their perceptual problems. People with behavioral variant frontotemporal disease tell us that they really need help on how to navigate social connections, given their behaviors are seemingly different or odd to other people. People with Lewy body dementia wanting information and support about how to manage movement problems. So you can see that each of the different types of conditions have specific needs. In terms of personal and interpersonal needs, people want to remain in charge of their own decision-making as long as that's possible for them, and they want to plan for the future, but need some assistance in doing that. People tell us that intimacy and companionship with their partner, particularly when they're younger and have young family at home, how they're going to navigate that and manage that. As I mentioned, childcare or parental care responsibilities, maintaining their relationships with friends, colleagues at work, for example, or other family members. And common to everyone, I think, with dementia and care partners, managing their mood and stress or anxiety or loneliness, as well as maintaining engagement in meaningful activities. So a lot of the people we speak to in their 40s and 50s, they're still very much physically active. They want to continue jogging or skiing or canoeing or fishing or whatever it may be, but needing support to do that. In terms of financial and legal needs, some of the people we speak to want to remain employed and want to be supported in their employment for as long as that's possible. Or how do they navigate a job loss, or when they're fired or forced into early retirement, and then the subsequent impact on income and benefits or pension. As well as then thinking about advanced care planning and power of attorney. People tell us a lot about their direct care needs, and because people are that we're speaking to have different types of dementia and their memories aren't impaired, and that they still are very articulate. They can tell us a lot about their thinking in those earlier stages of their illness, and some of the things they tell us is that worry about becoming a burden and not wanting anyone to be burdened as a result of this degenerative condition. And how can they talk about that early on with individuals so that sense of being a burden doesn't emerge, or they feel reassured that they're going to be cared for over time. Another person told us, "Remember my name." And I was struck by that, because it spoke to me of people wanting to be recognized as still an individual, as a human being with thoughts and with feelings and with personhood, and not to be treated just as another person with dementia. A care partner told us to accept this honor. So acknowledging their role as a care partner, but as an honor to be able to care for someone that they loved so dearly, which gives another frame into, often we talk about care as a burden, but in this instance, feeling that it was very much an honor. Getting the right home help, the people who understand the nature of their symptoms and their needs as a result of their dementia being different. Again, recreational and social activities, how to navigate other health conditions that might emerge over time, and then thinking about long-term care and end-of-life care. And this fear for younger people being put into a nursing home in their 40s or 50s and feeling young and out of place amongst a much older population. Peer support features very strongly, as it does with other forms of dementia. But what people are telling us is that they want condition-specific peer support. So people with PCA meeting up with other people with PCA, or people with FTD meeting up with other people with FTD. Peer support can also be mixed, because people say, they have problems and issues and things they want to talk about that would be consistent across anybody experiencing dementia. People are reinforcing the importance of what they call budding. So two people with the same condition meeting up and doing things together and continuing their ongoing socialization. Volunteer work outlets are a popular comment, given they've given up employment, but still feeling capable that they can still do something and contribute to others, and so wanting support to do volunteer work. And then finally, the importance of continued advocacy, so people understand these different conditions and that support is available for them, and learning more about these conditions and understanding that, dementia isn't dementia, not only because of the different conditions, but the different individuals that it affects. So sharing their stories is important to people, and that's why many people are participating in research such as ours, as well as engaging, and we have people who are contributing to teaching current and future practitioners in healthcare and otherwise, to make sure that our future generation of dementia care practitioners are familiar working with these different types of conditions. So I'll just briefly return to this diagnosis for us all, and to end really on I think, a positive note, because we often read about, again, the burden of care and what conditions like dementia can do to families. But families are indeed telling us that they do continue and can continue to support and care over time, and that families can continue to do family. And so what I mean by that is that they're still celebrating and still want to celebrate milestones and special events and other celebrations that we have across the year. So families are still managing to do family even though someone has a condition which is impacting on their lives, but they're able to navigate it in a positive way. People are also telling us about the importance that we don't live our lives independent of anyone. In fact, we live interdependent or linked lives. And so if I have dementia, then it's going to affect my partner and spouse. It may affect my parents if I'm only 40 years old, my children, my siblings, and my friends. And yet we tend to focus support for people living with dementia or a partner, and we don't really think about parents, children, siblings, and friends in the same way. As individuals are living with dementia, they're also experiencing individual and family transitions. So they're experiencing transitions with their condition as the dementia progresses, but we're also experiencing the normal individual and family transitions that we all have. So for example, as a child graduating from high school and going off to university, or a family member retiring from full-time employment. And sometimes these transitions are not thought about in the same way, or overlooked, or can become particularly stressful if we layer that on to transitions that an individual may be experiencing because of the condition. So supporting people and thinking about how we manage the normal transitions that all of us have alongside transitions that are specific to the condition. People are definitely reinforcing that individuals and families have the capacity to adapt and do adapt, some better than others, and some needing more support than others. But there is the capacity for the family to adapt and adjust and to continue to support one another. However, the availability of family support services are also hard to find or patchy across the country. So just finally, just to sum up in terms, if we were to think about rare dementia support in Canada, and that this is support that is tailored, and we look at the model that we have in the United Kingdom as well as what people so far are telling us here in Canada, is that we need to think about services where tailored information, advice, and support is available. So tailored to the type of condition. That we need to continue to think about professional education in relation to dementia, and that we talk about dementia diversity. That we need to continue to advocate on behalf of all individuals who are experiencing dementia, so that it's understood within the country that the right supports are there, and that we lessen the issues around stigma. That we need to continue to learn through practice, through supporting people, working with people who are living with these conditions and their families. And research is one way of doing that alongside practice. So our research, we are supporting people, we are providing support groups at the same time as researching to learn more about it, as well as ongoing collaboration and knowledge sharing throughout the dementia care community. There's individuals and other charities providing dementia care, individuals in hospitals and in care homes and in the community, and we need to work collaboratively together to ensure we're meeting the needs of people with these rarer forms. I just want to acknowledge and give special thanks to the funders of this project. And just to give you a sense of, in the United Kingdom, this particular project is a substantial multi-center 5-year study, and roughly to the equivalent of $8 million supporting this study alone. So you can see how seriously this is being taken by the size of the funding. I'd like to acknowledge our colleagues both in London and Wales who are working with us, and all of the research participants that have engaged so far. But as I said, we're still willing to receive more people. And we have an advisory committee here in Canada that is also advising us with this work, and we'd like to thank them. My contact information and Adetola's contact information are there, so we're happy for you to contact us at any time. And I think we have some time for some questions. Thank you.
Right, so thank you, Mary, for this very informative webinar. And thank you all for joining. Anyone has a question for Dr. Mary or Dr. Adetola? Feel free to writing on the chat box or the Q&A box, so we can also read it out loud.
Oh, I apologize. Someone said the slides are very small. I apologize if they were difficult to read. I don't know if it would be helpful if you want to share them later, if that would be helpful to Barbara. I'm happy to do that. I apologize, Barbara. I tried to make them large. I thought I was on full screen, but even so, I know they're sometimes hard to read.
Yes, for sure. I can share the slides after the webinar. So I have a question, Mary. So I really enjoy this topic because rare dementia is something that sometimes we don't address or talk much about. And I think it's so important to address different types of dementia. And this is actually why we're trying to be more inclusive and address other type of support and different communities. So overall, what's your experience, or what's your experience or your comments or your thoughts about working with this rare type of dementia overall?
Well, you know what, I think that is a really interesting question, because I've worked with people with dementia for most of my career, and there certainly are opportunities where despite the diagnosis, that there's commonalities that we all share, right? In terms of when you receive the bad news, or as you progress and adjust, and how your family and friends continue to support, and some of the challenges. But when I think about working with people who are younger and have a diagnosis that isn't Alzheimer's disease, I do hear their frustration in terms of their desire, and strong desire, to get information to help them understand their specific condition and what that's going to look like for them versus somebody with Alzheimer's disease. And I guess the other point then is that because they're younger and they have these other different responsibilities to navigate, wanting to some support and guidance in terms of navigating that. For example, how do I, explain to my 14-year-old, that I have dementia, and what that's going to mean as a parent, for example, and wanting advice to navigate some of those sort of complex situations that they encounter. I think that here in Canada, people are very appreciative of the support that exists, but there's not enough of it. And so are having to reach out, and we have many Canadians getting support over in London, England, virtually, because they haven't been able to locate support here in our own country. But so we have a good support system that needs a bit of strengthening to support that population. And I don't know, maybe Adetola wants to add something there in terms of her experience.
Yeah, thank you, Marika. Guess what I wanted to add also is, just like you mentioned in your presentation about that sense of agency, people still feeling that they have the ability and capacity to contribute to their communities, to their families. And so you hear that quite a bit from younger people. And so that also reflects in terms of the kinds of support that they'd want to receive. So for example, they'd say they don't want support that provides opportunities for them to just sit around. They want support that keeps them engaged, to be able to do the things that they used to do before to sort of feel that sense of competency and achievement in themselves and to their families. And I think that also ties into their willingness and really enthusiasm. Each time I speak to a research participant, there's this sense of privilege I feel of being invited into their space to hear their stories. There's that keenness to share stories about their experiences. And most of the time, the focus is on to help others. So I already have the diagnosis. There isn't a cure yet. There may not be much that can be done for me, but for someone else who may be diagnosed 10 years down the line or 20 years down the line, sharing my story and my experience can contribute to building knowledge that can inform support, interventions, diagnosis that will help them. So that's something that I hear a lot as well, which I find really, really very inspiring.
Well, thank you so much for those comments. It's really, I'm really glad to learn more about this topic, and for sure we also open to more education and more advocacy for those people who are suffering from rare dementia. So any other question from the crowd here? Anyone from the Dementia Society or any caregiver that wants to ask Mary and Adetola any question? Right, so
that's fine. You know what I was just going to say, right? Every time we have a conversation with somebody, it sparks another idea, reminds us of things that we can do to strengthen what we're already doing. And so we're just delighted to have had the opportunity to share with you.
Thank you so much, Mary and Adetola. And so anyone who wants to watch this presentation again, this is going to be available on our YouTube channel. And thank you for tuning in. Also, we have the weekly roundup, so you can register for more education and support. And you can also visit our website, dementiahelp.ca. So again, Adetola and Mary, thank you and have a good day, everyone.
Well, I'll send the slides as well to you so you can circulate them if anybody wants them.
Absolutely. Thank you so much.
Thank you so much.
Thank
Bye-bye
you.
now.
Bye-bye.